So we're going to take a look at a black tattoo here. This patient has never had this tattoo treated, so this is the first treatment. And this is not the questions I've already asked this patient are whether or not this is a cover-up tattoo, i.e. is there a second tattoo over the first tattoo, and there is not. This has just been tattooed once. We're going to start with the 1064 nanometer wavelength here because that is ideal for black ink such as this. And because there's quite a high density of ink in this tattoo, we're going to choose a low fluence for our test spot and go up from there as needed. My endpoint is a crisp white spot without pinpoint hemorrhages. And I'm going to do a little test pulse right up in here. So I'm going to confirm my handpiece is 1064 nanometers, 6 millimeter spot, 1064 nanometers on my faceplate, 6 millimeter spot, 0.9 joules, and 10 hertz. I'm going to do a test spot right here. 3, 2, 1. And this spot here is not quite white enough or crisp enough for me, so I'm going to go up in my fluence. But it was a very nice, safe starting point. I'm going to wait for the beep for the laser to tell me it's ready to go. And I'm going to do another test spot adjacent to the first. 3, 2, 1. That's better. Was that tolerable for you?
Mm-hmm.
Was that pleasant?
Pleasant wouldn't be the word.
Pleasant wouldn't be the word, because I wouldn't want the patient to tell me it was just fine and they didn't feel anything, because that would mean I'm just too low. I'm going to go up just a smidge more. This crisp white spot is due to, when you look histologically in the skin, it's due to immediate vacuolization, and it dissipates almost immediately. So the whitening that occurs with tattoo removal treatments does not stay, and you need to inform patients of this because they think that you've immediately removed their tattoo and you have not. I'm going to do an adjacent test spot again. 3, 2, 1. Now that is a very nice fluence. I can feel in the skin the snapping feel when you're really targeting the ink. So my endpoints are a feel in the skin, a crisp white spot to see, and no pinpoint hemorrhages. 3, 2, 1. And I'm just going to paint over the tattoo, airbrush over it, and cover the whole lesion. Good. 3, 2, 1. Are you breathing?
Mm-hmm.
Good. You tolerating this okay?
Mm-hmm.
Excellent. We apply topical anesthetic to these for 30 minutes prior to treatment with a combination benzocaine, lidocaine, and tetracaine. And that does help take some of the sting out of the treatments, but all patients invariably feel discomfort with tattoo removal. They usually report that it feels about 10 times more uncomfortable to get one removed than to have it placed. 3, 2, 1. I'm going to be over in here. I'm going to have you rotate your leg for me and stay right there. 3, 2, 1. So immediately after tattoo removal treatment, you want to apply ice. This helps with discomfort, and it also helps reduce risks of complications such as blistering. Blistering almost never occurs with the 1064, but it can occur with the 532 nanometer wavelengths, as it's a shorter wavelength and can cause more epidermal injury. But 1064 is a nice deep dermal wavelength, rarely causes blistering, and you can see that's a beautiful first treatment for a black tattoo.